had breast cancer back in the 90s and actually received my treatment at the Cross. It was a year getting chemo and radiation and working. I was at the U, so I'd go and get my chemo in the morning and then cross the street to the U and work in the afternoon. But it brought home to me my own mortality, which was important because you can, I mean, I was in my just early 40s, and and it was, I mean, devastating. It was not operable. But I thought to myself, I have to accelerate the pace at which I want to do things in my life because I might not be around. And so it did change the way I view my life. I was always a long-term planner, and I would say I'm more long-term than short-term, but it did bring into perspective if there are things that I think are important and that I want to do, then I will move on them. So, for instance, my volunteer life really picked up quite a bit after I, was out of my chemo, and I started to do a lot more volunteering because I thought it was important. But it also gave me a good perspective of the healthcare system from a patient perspective, because I've been in healthcare all my life, so I knew a lot. But how powerless in many cases I felt, and I thought to myself, if I feel powerless, imagine an individual who doesn't really know anything about the system. So I often look at that, while certainly it was a traumatic experience for me, but it did give me a good perspective on what it means to be a patient in the system, and I think that's very, very helpful.